Welcome to Health Matters, and on today's episode is a special episode for us as we're shooting it from the Botanical Gardens in Harare at the Good Food Festival in Zimbabwe. Joining me on today's episode is Dr. Michael Bhebhe, who's a specialist in biochemistry with special emphasis on African and herbal medicine. Dr. Michael Bhebhe, welcome to the show.
Thank you very much for having me.
It's actually a pleasure hanging out with you, Mike, and thanks for making time for us. So, first of all, let's talk about the importance of the Good Food Festival and the value addition it has in Zimbabwe.
Right, thank you for the opportunity to come for this interview. So, this festival is meant to bring people who have an interest in natural products and adding value by making innovative products which are palatable to the modern day consumer. You know, natural products have always been a poor man's food for the longest time, and this kind of festival helps to bring us back to where we used to be, when we used to eat organic foods and how healthy they are and so forth. So it's basically meant to show the trending innovations that have come to be in existence for as far as herbal and natural products are concerned. Yeah.
Thank you so much, Mike. But I'm just going to be throwing in a lot of questions at you. It's a question and answer session, and a lot of people want to understand herbs and African medicine. And the first and foremost question that's most important is, how regulated are these medicines? Who regulates them? Who talks about the dosages? Are they safe to use?
That's a very good question, actually. I get that a lot. Being a scientist, I'm a biochemist. My main thrust in my research and a researcher has been in herbal medicine, just extracting chemicals from indigenous herbs and quantifying it and testing for the activity. So I've come to realize that a lot of people have questions along the lines that you've asked. And just to put that to rest, a lot of our herbs that are in use are generally regarded as safe. Most of the herbs that we've seen in use out there, but there's always that danger. Natural is not always safe. As scientists, we come out to find out the toxic range of these herbs that are already being used. If herbs were dangerous, we would not be in existence right now, because before conventional medicine came, people were using these herbs and they survived. They were being used to treat, to heal, to nourish, and do all those things. But then we need to establish toxic ranges, because there are some people who are now trying to commercialize herbs and just giving them without any quantifications. So we try, as the scientists in the labs, in universities and organizations like TMPCZ, Traditional Medicine Practitioners Council of Zimbabwe, and MCAZ, Medicines Control Authorities of Zimbabwe. They regulate anyone who's trying to commercialize herbs which are medicinal. If it's food and also medicinal, it can be regarded as a nutraceutical, which you can just profile it, quantify iron content, zinc content, fat, protein, and so forth, and then just sell it. Because if it's food and medicine, usually those ones are very safe. But the ones that people then decide to make medicines, they have to go through the local authorities, which I've mentioned earlier on, to regulate their quantities. So there are ngangas, just to preempt maybe some of the questions that might come. Ngangas and traditional healers and herbalists who use these products and give to people, they have bodies that govern them, which help them to give people the right quantities. Because in case there is anything that goes wrong with the herbs that they give, the products that they give, they answer to Zinata, they answer to TMPCZ, because they have to regulate the quantities that they give to people.
Looks like Doc has answered all the questions, so we've come to the end of our episode. But hey, Doc, let's talk about the use of organic medicine, African herbs, in conjunction with conventional medicine. Let's say I've been prescribed something for my hypertension and I use moringa in conjunction. Is it not duplication of effort? Is it not increasing toxicity to the kidneys? How safe is it to use herbs in conjunction with conventional medicine?
Even in conventional practice, you are not supposed to mix certain drugs. The thing with herbs, like for example moringa, they have a lot of chemicals which may not have been accounted for in full. Or rather, we might know moringa has a lot of chemicals, but then it has too many chemicals which might interact with the drug in a negative way. Drug to drug, moringa might have a drug in it, which is a chemical in it, which might counteract the effect of the conventional drug. So it's usually wiser to, if you're sticking to herbal medicine, focus on that for that time, and then if you're going to use conventional medicine, use that for a particular season until it works out. Or if it doesn't, then you change to the other version.
Quite interestingly, statistically, over 75% of people in Africa first seek religious or herbal medicine before they go to conventional medicine. So even back home, when you have a flu, you're most likely going to look for lemons and oranges before you go to the pharmacy. So thank you very much for addressing that. Which brings me to the next question. We're going to talk about, of course, the burning issue. Everyone wants to know about aphrodisiacs. You walk in town, you're seeing a lot of maguchu, you're seeing a lot of premixtures. How safe are those? And I mean, these are quite popular with a lot of men. How safe maguchu, mishonga sana, et al. With regards to the human body and conventional use?
Like I said earlier on, if it wasn't for this herbal medicinal practice, we would not exist. It was used since time immemorial. My role as a scientist so far is just to validate the maguchu that you're asking about. There is, however, a danger with how maguchu are being distributed generally in the cities. Most of the people who have been selling them have not been licensed, and there's the danger of selling things at a toxic dose or without giving the accurate dosage that people need to use it at, hence giving rise to dangers in toxicity and kidney damage, among other things that happen. But generally, I would say from my experience, the guchus and them, they are quite useful. Actually, they do work. Ask any man 30 years and above who has tried it. It has worked for them. They work. But there's that looming danger of toxicity that still has to be regulated, because most of the people who tend to sell these sell them in secret and they are not licensed. So there's that danger. But generally, I would say it's possible to have a herbal guchu which a man can have in his room, in his house, which he can use every other time, and it works for him. Yeah.
Well, the doctor has spoken. I mean, speaking of also maguchu, there's the other type of maguchus, not the aphrodisiacs. They're the cleansing maguchus. And I mean, from a scientist's point of view, I view that as someone disturbing the normal flora. Because when you clean out all the bacteria in your stomach, you've just cleaned out the years and generations of normal flora that's in your body. What's your comment on people cleansing the gastrointestinal system using herbal medicine?
I think you have a very valid point. It makes sense because some of the herbs that we research on in the lab have antimicrobial activity, which can work for or against the gut flora, the microorganisms. But it's not all the herbs that are taken in that destroy the gut microorganisms. Cleansing does not necessarily mean you are getting rid of the gut microorganisms. Sometimes it's reacting with certain products that are already in the system that need to be flushed out. It's not only destroying the microorganisms. Cleansing using herbs is actually a very good thing. Some of the herbs that are taken in can act as laxatives. So there's the chemical component which stimulates certain hormonal activities within the body, which is a good thing. Yeah.
Thanks, Mike, for raising the issue of AMR. It's a burning issue in the Zimbabwean healthcare system and the world at large, antimicrobial resistance. And with the use of herbal medicine, how controlled is antimicrobial resistance? How alert, what's the vigilante like on your side as a herbal medicine practitioner?
Yeah, I think antimicrobial resistance is a real threat to public health in many ways. So the issue of people using herbs unregulated always poses a threat of microorganisms then becoming resistant to certain plants. That has been in existence. But the advantage of herbal medicine is that plants tend to experience different kinds of stress, and which makes them produce different chemicals in different seasons and different moments of their existence during growth. So sometimes plants tend to have an edge over microbial organisms because they always experience different kinds of stress around them, and then there's always that new product that always kicks them and then destroys them over time. So there's always an edge, unlike a conventional drug, which is the same chemical that has to attack the same microorganisms, and the microorganisms adapt and quickly gets an advantage over the drug that you're using.
During the COVID season, we had a lot of people using Zumbani, steaming with Zumbani, kunatira, using Zumbani to prevent and to manage COVID. A lot of Africans, Zimbabweans in particular, believe that because of Zumbani, the number of fatalities we had to COVID is reduced. And even when people have a flu now, they use Zumbani and the likes. My question is twofold. What is the efficacy of Zumbani against COVID and other seroviruses? And what also is your efforts in taking the Zumbani active reagent and putting it into conventional use to treat flus and the like?
That's a very relevant question for this era, because during COVID, Zumbani, definitely in Zimbabwe, Zumbani was like the wonder herb. And I happened to be the only scientist, I think at the time, who had published work on Zumbani at the time. Now there's a lot of sprouting publications on the plant because of how efficient it seemed to be during COVID. I would not intrinsically say Zumbani was the one that was managed to cure or prevent people from dying from COVID, because we still don't have evidence that is significant yet, unfortunately. By now we should be having enough evidence to confirm and claim that Zumbani is that good. But I can claim that Zumbani has been tested for several chest-related bacteria and viruses like tuberculosis, influenza, among other viruses, including COVID. Is still underway. It's still yet to be confirmed. But I can say it might, a big might with a bold, have been significant in reducing the onset of the spread of the virus. Of course, many other aspects led to us not contracting the virus as much as others in the first world did. Yeah.
So, Doc, you've answered a good number of our questions and even some that I hadn't asked. But to wrap up our session, what is the future with regards to the use of African medicine, putting it into conventional use, into conventional diets? Are we still going to be having to wait for medicine to come from India and China when we have our own active ingredients and reagents here?
That's a beautiful question to end this segment, actually, because we are here. This is a good testimony of this type of future that we're looking at. Like I have with me this, as you would know, this is a frisit made from rosella and mint. Then there's this one made from Zumbani and lemon. So cheers to that. So the future really looks bright for Zimbabwe. Nice, really nice.
Really nice. Yeah.
I wish the viewers could taste it.
I wish we did it.
No, the future really looks bright because since 2020, a lot of people have been finding interest in herbs, indigenous herbs, local herbs, and trying to find innovative ways of bringing them into the modern day consumer. So this is a product from Bio-Innovation of Zimbabwe, which is the stand right behind us. I've worked with them for the past 15 years, and they've made a lot of progress in training indigenous farmers who are growing Zumbandi. They are growing Mufandi Chimuka. They are growing a lot of indigenous herbs, and they are packaging them and making products which can be used by which can be consumed by the modern day consumer. So the future really looks bright. Universities now with Education 5.0 are now focusing on making products which can then find their way to the mainstream. We're trying to be innovative and make products and just publish work and then just say, this is good for this and that, and not reaching out to the industry. So yeah, I think the future is bright.
Thank you so much, Dr. Michael Bhebhe. This has been Health Matters. We've been talking everything about African natural herbs, and we're here at the Good Food Festival in Zimbabwe, being held at the Botanical Gardens in Harare. It's always a pleasure talking Health Matters. And until the next episode of our question and answer session with specialists, wish you well and stay healthy.